But our 1815 grant, which is we're going into our third year of funding from the Center for Disease Control and Prevention through the state of Wisconsin Department of Health and Human Services. And the 1815 grant is around prevention of chronic disease, particularly related to diabetes and to hypertension. And so we were planning a day of learning, and the day of learning has been canceled due to the pandemic and COVID-19, just like many conferences that have been canceled. But instead, we're going to redesign. We're going to do a pivot as we're seeing in a lot of the news these days. And instead of doing just a single day of learning, we're going to be calling it a days of learning. And that's going to be the title of our podcast interview series. And we're going to interview all sorts of people, from physicians to people that do with nutrition, education, anything that relates to health and wellness, especially as it relates to disease management. And I can look across the screen, and every person on this call has a place in terms of being interviewed and to provide information to others. And so we're excited about this, and we're going to be recording these and having these as products, and we're going to see what comes out of it. I am thrilled to start this process by having an interview with three colleagues and, I will say, dear friends. Brett Fuller, curriculum specialist with health and physical education for Milwaukee Public Schools. Yvonne Greer, dietitian and principal and founder of Why Eat Right. And Christopher Simenz, clinical professor in programs in exercise science at Marquette University. We're going to be talking about physical activity and nutrition in the midst of COVID. And we have heard a lot in the news and seen a lot in the news around nutrition, physical activity. And we're going to focus a little bit on some of the things that they're seeing from their specialties, but we're also going to do a little bit of a question. One of the questions will be around your personal practices, as well as how we might think about chronic disease management, which in many cases has potentially been cut short or not given as much emphasis. Chris, I want to start with you. If you could talk about the idea of how has activity changed as a result of this pandemic from your perspective as an exercise scientist?
A great question. There are a number of ways that activity has changed. Specifically, activity has been reduced in the most global sense for a lot of people. And the real problem with that is multifocal. I think that Yvonne hit on such a really important point earlier today when she talked about the impacts of what's going on societally with the outrage that people have nationally with what's going on with COVID, with the isolation that's resulted in COVID. Reduction in physical activity leads directly to increase in stress and the inability to manage stress, not only in the body physically, but emotionally, socially, and psychosocially. So people tend to have a lot of outlets. For many people, exercise becomes an outlet to reduce and mitigate the impacts of stress, whether it's their workplace stress, their family stress. Without that, people are really reducing activity patterns and stress levels are going up substantially.
So I want to drill down a little bit on that. So yeah. if we know that it is a stress reducer, which we know, and we can think of the neuroscience that goes with it, what's playing into this idea of a reduction in this space?
Well, so the reduction in physical activity in this space, David, is that what we're talking about?
Yes.
The reduction in physical activity has been due to isolation. So a lot of, so Kelsey used to go to her gym, but now Kelsey's got to do the online. Well, Kelsey's got access to online, and that's fortunate for her. Many people don't have the same level of access. A lot of the public spheres, let me give you an example. We've got Whitefish Bay, we've got some significant biases in the way that we restrict access. We took down all the basketball hoops at all the facilities in Whitefish Bay. We actually pulled them off of their stems. Well, let's say in Whitefish Bay, we've got a different group of kids that tends to play basketball than might play tennis. We didn't take down the tennis nets in Whitefish Bay. Everybody's still playing tennis. So who does that disadvantage? That disadvantages kids, specifically children of color that tend to play basketball or outdoor hoops in Whitefish Bay. We've got a systemic process that disadvantages some over others. And when we disadvantage physical activity, we're not allowing outlets for stress. So it's the closure of these spaces that has been the problem. And this is creating negative health implications, and it's disproportionately creating them in already marginalized populations.
Thank you for that, speaking into that and speaking into some of the systemic issues. Brett, could you go a little bit further, especially from the youth and adolescent, based upon what Chris is seeing in both the reduction and some of the systemic issues?
You know, it's really interesting listening to Chris, and physical education is actually trying to take this use this as an advantage. What's happening here, and try to talk a little bit more than about the physical activity. So I can't argue with what Chris is saying, because what we heard in the first 3 weeks of the closures consistently in the Milwaukee area, at the state level and nationally, was parents were yelling for ideas around getting their kids physically active, but they were calling it physical education. We need ideas for physical education at home. And so people have been doing a lot of things around the world. There's been people stepping up saying they're the physical educator of a country and stuff like that. And they're doing all these great videos for physical activity, and which is fantastic, which we need to do, but it's not physical education. So what we've done in Milwaukee Public Schools is we provide calendar ideas, weekly calendar ideas for the last 6 weeks around different physical activities you can do in your home without having to go anywhere. We get some of those ideas from Shape America, our National Association for Health and PE, but then we also look for other resources like videos and things like that. But then not only are we talking about in our recommendations, we're still telling students to be physically active, our children to be physically active 60 minutes every day. And we give them the idea of 4, 3, 2, 1. You could go out 4 times for 15 minutes, 3 times for 20 minutes, 2 times for 30 minutes, or 1 time for a full hour, but get that hour in every day. This calendar sent home, if the teachers are working with them online, weekly to the students, and part of it is share this with your parents. So that's one of the things we're trying to do to stem some of this. And then the real thing that we're talking about physical education is, let's make this link. Just don't tell kids to go be active. Let's start making the link with the young ones to say that first week our focus was, what are the benefits of regular physical activity? And right in the documentation we provided to the students and their families, it said regular physical activity boosts the immune system. Regular physical activity reduces stress. What other benefits are there? And so the kids can start working on that. So while I agree with what Chris is saying, that there's been a reduction, there has been a recognition, I think, that we've seen from families that their kids need to be more active for some of the things that Chris was talking about, but they wanted ideas what they could do in their homes. And so trying to be creative and come up with new things like that. But we've got a lot of creative people in this field all over the country, all over the world, who are doing some really phenomenal things. And so I think we've actually stepped up and done a nice job, but it's hard to measure the impact. Our teachers are sharing the resources, but we just don't know how many students are actually taking advantage of it.
So I want to, first off, I want to say, one, congratulations to you, Brett, for becoming the president of Shape America. If you're not aware, Brett is the president of Shape America. And Shape America is the governing oversight body for physical education across the U.S. Brett, can you speak a little bit into some of those linkages that you mentioned at the national level? What are you hearing and what are you seeing? And if you have an example of somebody who's really doing it right around physical education and continuing that during pandemic?
I don't have a specific example. I've heard things from my peers in Seattle, my peers in Chicago public schools, who are providing resources and doing and continuing to provide online virtual, I shouldn't say call it online, it's virtual physical education. There's a difference, because in a virtual physical education setting, you still have a live teacher doing something. The online can be just specifically just a computer program. So there's that. But I think that one of the things that we're hearing, though, is a fear that there are some places around the country, for example, California, they eliminated the physical education graduation requirements this year. They're supposed to be a temporary fix, but they're trying to say schools can't do this right now because of COVID. And that's the furthest thing from the truth. And then recently there was a school in Massachusetts that has eliminated art, music, and physical education from their entire school district for the coming year, 2021. So this, of course, has sent fear through the hearts of many physical education and health teachers across the country, because there's a misunderstanding of what we're capable of doing. And we are capable of providing distance learning for our students. And at this point of time, it's, as Chris was saying, it's more important than ever to be helping students understand and youth understand why they need to be physically active for a lifetime and give them the tools to do so. If people are looking for great resources, shapeamerica.org has been collecting all the resources from teachers and from vendors, and created some themselves during this crisis.
Thank you, Brett. Chris, go ahead.
Yeah, so to Brett's point, I think there have been some unintended positives as well. I monitor very closely the sport and competition organizations, which have been really adversely affected by this, because sport and competition tends to lead to this prolonged close contact, sharing of body fluids, or aerosolized respiration that might spread the virus. But what we've seen at the level of youth sports, which is really interesting, is a shift away from competition and really, really heavy skill development to a shift towards athleticism and movement patterns, which is something that at the level of sport we moved decidedly away from, which is unfortunate, because we weren't raising athletes anymore. We were raising high-performing, highly competitive students, and that's not necessarily a wellness benefit. Now we're seeing in this, because students have to work out in isolation, we're seeing sports programs coming up with training and online training and virtual trainings that are giving students the ability to start working on athleticism and general athletic skills again, which has been really positive and fundamentally a change from what we've seen in the sporting institutes for kids nationally for the past several years.
And we know from this that I really like this idea of linkages, and what you were saying there, Chris and Brett, talks about the link between physical education, activity, lifetime activity, and community, which is often lacking. And so maybe this is that opportunity for us to go a little bit further to make those linkages. Yvonne, I want to bring you in. And for those who aren't aware, Yvonne has been around. She is very experienced in the field of nutrition and dietetics. The former president of the National Organization of Blacks in Dietetics and Nutrition, known as NOBADAN. She's also been on the Governor's Council for Nutrition and Physical Activity, and worked for the Milwaukee Health Department for over 30 years as a member of Milwaukee. You kind of bridge both areas, Yvonne, from the local to the national. And I'm wondering if you can speak into what Chris and Brett are saying about what you're seeing from the nutrition front around wellness.
Well, I do want to speak on the nutrition front, but I do want to just make sure I mention that with the physical activity pieces and how that has impacted the African American population, because quite a bit of some of the activity that was normally conducted, and people say we're not active, but at the same time, much of the activity was done in a kind of social type of a setting with family, friends, best friends, you know, yoga groups, walking groups. And once you took that away, the idea that, you know, people just walked by themselves or they just went out, you know, on their own, that was a big difference, because people did have certain people they hung with. So they do have a lot of online things. They have a lot of online yoga classes and fitness classes people are starting to get in. I found the online senior class, but these are programs led by people. They're not, videotapes or anything. They are led by real people. And so, and then Girls Trek is another one. They're trying to get 1 million women to start walking, and they're, having people take pledges. And so there is a movement to get people moving. And I think some of the fear has come into play, that people are realizing when we talk about cardiovascular disease, we talk about having a higher risk because of diabetes, of being not nutritionally sound. It really was a wake-up call that they're saying African Americans is a higher risk because of these issues. But yet they also know that the stress level is there at the same time. So, and that stress level was an inhibitor. So now people are starting to realize that maybe we do have to start dealing with the stress and the mental health that we are carrying. So it is, I would say it has increased an awareness that I don't know was actually at the forefront before. I think people were just trying to survive. But now they're starting to see it's not just trying to survive, that we really do need to take care of ourselves. So I think there's starting to be a shift in thought. And I'm getting requests for more and more talks on nutrition and immunity versus just general nutrition or just cooking or, something like that. People are wanting more specific information on what should I eat and how should I eat it and what's the amounts that I should eat, which is, I think it's an awareness that people understand that they may have thought they were doing it right, but now they know they probably weren't. And so I'm getting lots of requests. I actually have a presentation this evening. I've got some things in the book in July. I've been on about 3 or 4 different online programs talking about nutrition and immunity and some of those specific items. Like I said, instead of the my plate is still there. So, I mean, I still use my plate, but they really are saying out of that plate, what, instead of saying eat in this category, they say, what in that category should I be eating? What should I be eating to boost my immune system? They've gotten that message. And when I first went to the grocery store, when COVID first started, I was the one worried that there would be no lemons. I was just cringing to think all the lemons are going to be gone. I won't be able to get any lemons or limes. I went over there, it was stacks of lemon and lime. A month and a half later, went over there, those lemon and limes were gone. And so, I mean, I was happy about that, the idea that now I'm seeing the lemons and limes leaving, because people have now know the benefit of having natural vitamin C in their diets, but that wasn't something that they were doing before. Pills are important.
Thank you. I have a question for all 3 of you. Would you all come back again?
Well, of course.
I think that's an affirmative. They gave me a thumbs up. We didn't even get, I knew we wouldn't get to all the questions, but I do want to point out a couple of things here that you guys, each of you had said. You've all in some way talked about this idea of isolation and fear and stress. And I think, Yvonne, especially the idea of a lot of things that we do around wellness and health and nutrition are done in a social setting, are social activities. And that is taken away. At the same time, and I would like to have another hour with you, but I want to be conscious of the time, because we know that chronic disease, diabetes, hypertension, cancer don't take time off during COVID, but are putting people at more risk if they're not getting the care they need, especially in the idea of awareness, the immunity that might come into play. So I think that's an opportunity for us to think about how we might practice COVID in the current, and as we think about this into the future. I want to thank Chris and Brett and Yvonne for being a guest on this podcast today. And you've all heard it. It's recorded that they agree that they'll come back, and we'll spend more time with them together and individually.